Okay, our study area is the New York City metropolitan, including Manhattan, Brooklyn, Queens, Bronx, and Staten Island. This map shows the number of people with income less than 25,000 by census tract. The darker color is considered to be a low-income area, and we could see that most of the low-income areas are located in Upper Manhattan, Bronx, and Brooklyn. New York City's transportation density is positively correlates with the income level in most boroughs, such as Brooklyn and the Bronx. Manhattan is different in this situation for its special urban form, and we will go back to each boroughs later specifically. Here's the PICS model of New York City's industry. We summarize the top 5 industry impacted by COVID. Overall, COVID-19 slowed down the economic growth of New York City, but luckily most of the industries are still growing after COVID-19. And now my colleagues will talk about the industries individually.
Thank you, JiYoung. This chart indicates the top industries in New York City, expressing economic change during the pandemic. The accommodation and food services sector experienced its sharpest decline at 31%. Similarly, arts, entertainment, and recreation faced a 27% decline. The retail sector declined by 13%. This is due to the stay-at-home policies enacted at the time. The industry that faced the strongest level of decline was accommodation and food services, with a 31% decline. This decline is likely attributed to New York City's pause mandate. Policies assure uniform safety for everyone, enacted on March 20th of 2020. This led to the direct closing of many restaurants, bars, non-essential shops, and entertainment facilities such as theaters and concert venues. The most notable declines in people using public transportation to get to work from 2019 to 2020 were within the service occupations, with a drop from 661,123 people to 615,664 people. Sales and office occupations with a drop from 615,426 people to 560,051 people. And production, transportation, moving material occupations, which went from 210,332 people to 197,084 people. This graph describes the number of people who report working from home in New York City in both 2019 and 2020. There is a visible decrease in work from home jobs in the management, business, science, and art sector. As the number of work from home jobs increased from approximately 240,000 jobs to 430,000 jobs, the service sector and sales and office sector also demonstrate increases. There is a minimal increase in work from home jobs in the natural resources sector and the production and transportation sector.
So here are a series of maps comparing the transportation change in each boroughs. We summarize the number of people who rely on public transportation and the commuting time in each census tract in both 2019 and 2020. The darker color is considered to have more people rely on public transportation, and the red dots represent the commuting time in those census tracts. In Bronx, areas close to Manhattan have more people rely on public transit. Most people in Bronx have to spend more than 40 minutes commuting, and after COVID-19, fewer people rely on public transit, and the commuting time remains the same. People who live in Upper Manhattan have the longest commuting time, mostly above 35 minutes. Fewer people are taking public transit after COVID-19, especially in the Lower Manhattan East. The commuting time also has slightly decreased. In Brooklyn, the average commuting time is longer than Manhattan. Borough Park, located on the south side of Prospect Park, is the only neighborhood with less commuting time than the rest of Brooklyn. Fewer people took public transit in 2020, but the commuting time has slightly increased in most census tracts. A similar thing happened in Queens. The total amount of public transit commuting decreased, but the commuting time has increased. Staten Island is different from the rest of boroughs. Both the number of people who rely on public transit and the commuting times has decreased.
And here are the GIS maps for low-income household, bus routes, and affordable housing in New York City. In the following 10 maps, New York City will be divided into 5 counties: Bronx, New York, Kings, Queens, and Richmond, to show and compare the distribution of low-income households, public transportation services, and affordable housing before pandemic and during pandemic. So the first 2 maps depicts the households earning less than $25,000 a year, bus routes, and affordable housing in 2019 and 2020 in Bronx County. According to the data visualization results, the low-income families in the Bronx are mainly concentrated in the southwest part of the area, near the Harlem River. Most of the affordable housing in the Bronx is concentrated in the southwest part of the area, and affordable housing tends to be concentrated in areas with high concentration of low-income families. By comparing the distribution of bus routes in 2019 and 2020, we found that the bus routes in the Bronx were basically unchanged. The pandemic had little impact on the bus routes in the Bronx, and areas with a concentration of low-income families could still use convenient bus services. The next 2 maps depict household earning less than $25,000 a year, bus routes, and affordable housing in 2019 and 2020 in New York County. According to the trend shown in the map, low-income households are concentrated in northeast and southeast of New York County along the Harlem River. And the distribution of affordable housing in that area is similar. It is worth mentioning that by comparing the distribution of low-income families in 2019 and 2020 and the legend value of the region with highest density of low-income families, we found that low-income families originally located in the southwest gradually moved out of the area in this year, and they tend to concentrate. However, the bus routes in New York have not changed greatly in this year. For example, as can be seen from the zooming maps on the upper right corner of the 2 maps, only 1 bus route along the Harlem River has been suspended, while the rest routes still maintain normal operation. Next, the 2 maps depict the distribution situation of low-income household, bus routes, and affordable housing in Kings County. The 2 charts clearly shows that low-income families in Kings County are mainly concentrated in the north, and the distribution of affordable housing is consistent with that of low-income families. By comparing the distribution of low-income household in 2019 and 2020, we found that within 1 year after the pandemic outbreak, the medium density clusters of low-income households in south and central part of Kings County gradually changed to low-density clusters, while some of the medium density clusters of low-income households in south area of Kings County changed to high-density clusters. By comparing the 2019 and 2020 bus maps, Kings County's bus routes were barely affected. And the 2 maps depict the distribution of low-income household, bus routes, and affordable housing in 2019 and 2020 in Queens County. As shown in the map, the medium density and high-density low-income family clusters are evenly distributed in Queens County, whereas unlike the other counties, although the affordable housing in Queens County is in high-density low-income family cluster, the number of affordable housing is small, and they continued to decline further in 2020. After comparing the distribution of bus routes in 2019 and 2020, we found that, like other counties, most Queens County bus routes are still in operation. Only a small number of routes have been suspended. Lastly, the two maps depict the distribution of low-income household, bus routes, and affordable housing in 2019 and 2020 in Richmond County. As can be seen from the map, low-income families in Richmond County are mainly concentrated in the north, east, and southwest region. Affordable housing in Richmond County is concentrated in the northern and northeastern areas with high concentration of low-income families, and it is scarce. After comparing the maps of 2019 and 2020, we found that the high-density low-income family gathering area in northern Richmond County gradually changed to medium density or low density gathering area, while the medium density gathering area in central and southwest area changed to high density gathering area. Like bus routes in Queens County, most lines in Richmond County are operating normally despite the pandemic, with only a small number of them suspended.
Beginning in March 2020, subway ridership declined by 96%, bus transportation declined by 78%, taxi pickups dropped by 86%, and for-hire vehicle pickups declined by 60% in New York City. Bike share increased rapidly at the beginning of the pandemic in New York City as well. On April 30th, Governor Cuomo announced New York City subway closures from 1 a.m. to 5 a.m. for sanitation purposes. New York City later followed a 4-stage reopening initiative. Public transit usage increased steadily throughout each reopening initiative. On June 8th, New York City began its phase 1 of reopening. By June 10th, subway ridership had hit its highest level since the start of the pandemic at 851,241 riders. Subway ridership increased at this time by 28%. MTA crossings increased by 54%. Vehicle miles traveled increased by 78.9%. On June 22nd, New York City began its phase 2 of reopening. At this time, the New York City Department of Transportation developed the Open Streets and Outdoor Dining Plan. On March 22nd, 2020, in response to COVID-19 cases rising in New York City, Governor Cuomo enacted the New York City Pause Directive. This policy ordered all non-essential businesses to close in-office operations and to limit non-essential gatherings of people. During the beginning stages of the pandemic, there were also policies enacted that simultaneously decreased subway ridership and increased bike usage. The MTA adopted the Essential Service Plan on March 25th, 2020, which limited the capacity and service hours of the subway. On the same day, the bike-sharing system City Bike introduced the Critical Workforce Membership Program, which offered healthcare, transit employees, and first responders free rides for 30 days. The COVID-19 pandemic had large effects on access and equity in New York City. Neighborhoods in all 5 New York City boroughs with higher rates of COVID-19 were communities of color that had higher relative use of the subway and other public transit systems even after the social distancing policies were enforced. Essential workers relied more on buses and other services such as the MTA Essential Connector Program, which provided 18,870 trips in May. Subway shutdowns from 1 a.m. to 5 a.m. made it hard for essential workers who work odd hours to travel. There were also impacts on equity in New York City as well. Our research shows that people of color were statistically more likely to work essential jobs, which led them to be more likely to have exposure to COVID-19. Wealthier populations were able to avoid the spread of COVID by switching to working from home and utilizing food delivery services, ultimately being less reliant on public transportation. Studies showed that social distancing was harder to abide by in disadvantaged communities because of the sacrifices having to be made to continue making a living and to retrieve food and groceries from stores.
For New York City, we had a variety of individuals respond to our survey, which gave us a broad spectrum of what type of industries our survey respondents worked in. Prior to the pandemic, a majority of our respondents did not work from home. However, you'll see a major switch when the pandemic began and during the pandemic for those who did work from home. Now, on the right-hand side, you'll see the respondents who are still working from home. A majority of them are not. However, we have a larger number of individuals who are working in a hybrid situation. We also asked if individuals had changed jobs or careers during the pandemic. 62% of our respondents did say yes. We had varying reasons. However, we saw common themes amongst individuals who were unhappy with their work situation when the pandemic started, which caused them to change their career or job and work with an employer who better met their needs throughout the pandemic. The preferred mode of transportation before COVID can be seen on the left-hand side, and on the right-hand side, you'll see the preferred mode of transportation current. You'll see that their subway and train usage pretty much remained the same. However, bus ridership went down, as well as bicycle ridership. You'll see a small increase in personal vehicles. However, you'll also see the preferred mode of transportation currently that rideshare did pop up. Rideshare can be defined as both Uber, Lyft, or other rideshare services available within New York City. Our average commute time really varied amongst our respondents. You'll see that we do have a large number of people that fall between 0 and about 45 minutes. However, we did have a large number of respondents that commuted for between 50 and 60 minutes. We also conducted interviews. We had 2 interview subjects for New York City. These were 2 respondents from our surveys. Our interviewees expressed similar key issues, such as their workload when the pandemic began and why they both chose to change employers. And they also expressed issues with the New York City subway system. Both interviewees indicated that since the pandemic, there has been an increase of delays in traffic with the New York City subway system, which does impact their decision to go into their employer's workspace. If our interviewees chose to use programs such as bike share, it would be done for leisure purposes, and they did not use rideshare as they found it could be very expensive or inefficient, meaning that it took the same amount of time for them to commute through the subway system as it would by taking a rideshare vehicle. When asked, our interviewees did express that their living location was determined by their community more than their job, and that they would consider moving out of New York City because their jobs do have a remote option. However, they were unsure as what the future looked like for them because of the ongoing changes throughout the COVID-19 pandemic.
Based on our research, we have identified some short-term policy recommendations. With ridership numbers for the MTA and Central Business District economic growth slowly recovering, these short-term policy recommendations are aimed to increase ridership in public transit, as well as increase economic growth and equity. First, we recommend the MTA to create and implement incentives to increase employment for public transit jobs. Evidence from our interviews suggests that there has been a shortage of MTA workers since the start of the pandemic, which has led to delays and hesitation in using the public transportation system. Potentially increasing wages in addition to increasing COVID safety precautions may alleviate this. In addition to this, the MTA should increase efforts to spread awareness about COVID safety precaution measures on public transit. Another short-term recommendation is to increase bike share opportunities in low-income communities. The City Bike program was extremely useful in many areas of New York City during the pandemic, but may not have been always the most accessible for those living in low-income areas, particularly in some areas of Upper Manhattan, Bronx, and Brooklyn.
Based on the data, the analysis of that information, and the literature review formulated for New York City, the following policy recommendations are ways to potentially increase public transportation ridership while also focusing on transportation equity in the economy in all parts of the city. These recommendations are policies that would have to be slowly implemented over a longer period of time. We recommend that the City of New York focuses on developing more public transportation opportunities in low-income communities. This could be done by adding more bus stops on existing bus routes and extending bus routes to reach more low-income communities and beyond. Building more affordable housing near bus stops or subway entries, or offering incentives to existing housing establishments to have a higher percentage of units available to people with housing vouchers could also make it easier for people of lower income brackets to have better access to public transportation. This is an important recommendation to be considered because lower income communities in New York City, like Queens and Richmond County, do not have nearly as many bus stops compared to other parts of the city that consist of people with higher incomes. The MTA app could also be improved and updated in a way that would allow users to suggest where they think a bus should be added. The MTA could use that feedback to decide where to add more stops based on demand and the distance from other stops. If someone suggests a stop somewhat near another, the app could give that person directions to the nearest stop relative to the suggested location. There could also be a feature on the MTA app or a separate app funded through the government that provides cheaper ridership options for people with low incomes. This app would be a more affordable alternative to ridership companies like Uber and Lyft. Improving the infrastructure for walking and cycling throughout the entire city is also recommended. Sidewalks are not suitable for walking and cycling in some parts of the city or do not seem safe enough. Redoing the sidewalks, adding more bike lanes, and streetlights would help people who are dependent on these modes of transportation feel safer. Some recommendations to remediate the local economy after the hit it took due to COVID would be to create more jobs that require people to physically come back to work. Also to assist the central business district in economic recovery, since it is one of the areas that greatly contributed to the economy pre-COVID that took a really big hit. This can be done by promoting safe tourism while increasing foot traffic in the area once again. Bringing people back to work in person and increasing tourism will ultimately increase public transportation ridership, which in the long run will stimulate the economy. Another economic-specific recommendation would be to incentivize and encourage new business development in low-income communities. More businesses opening in these communities would provide more jobs in the area, allow easier access to necessities that were harder to get when COVID hit due to changes in transportation schedules and store closings, and reduce travel times for people in these communities to retrieve things like food and other necessities or even work.